Dr. Stacy De-Lin, thank you so much for joining us on the Plant Trainers podcast today.
Thanks so much for having me.
We are really going to get into some science, some information today, and it's going to be a conversation unlike anyone that we've had on the podcast before. But before we do, we wanted to know if you have a moment of gratitude to share with us and the listeners.
I do. I'm just grateful for health. Like, I think that in this time, it's such a scary time and there's so much loss of life and so many people being sick. And, it's easy, I think, this year to focus on all of the things that we've lost or the things that we miss. I certainly do all the time, get focused on those things sometimes. But at the end of the day, I'm healthy. I have my family is safe. And so I'm really grateful for that today.
I think that's really important, just paying attention to those small things. And yeah, there's a lot of things we can't do, but what's everything we can do on a daily basis? And that's really what's getting people by day to day.
Yeah, I agree.
So can you tell us quickly, or not so quickly, a little bit about how you found a plant-based or vegan lifestyle and what changed for you?
Yeah, so I was a vegetarian from the time that I was a teenager. I grew up in an Italian meat-heavy family, and so it was a big transition then, and I didn't know a lot about veganism in the sort of small community that I grew up in, but then I got more and more exposed to the ideas about it, and eventually I went to a farm sanctuary, and I met the animals, and I found out about the egg and dairy industry, and that was it for me. And then, as a physician, I'm also well aware of the enormous health benefits, and I'm primarily vegan for the animals, but I think that, knowing what I know about the health aspect of it, there's enough to push me that way. And so I'm an athlete, I train every day, and I think that the reason that, I turned 41 recently and I still feel like I'm in the prime of my life, I think that that's all due to a vegan diet. So I've been vegan for, I think, 11 years now, and definitely one of the best decisions I've ever made. And, I'm happy to be able to share it with my patients and those around me.
We're just going to cut you off for a minute because you're totally frozen. Are we frozen for you as well?
No, you're good for me.
Okay, so then let's keep going.
Just keep going. Okay. It is so interesting how so many of our podcast guests come to it for different reasons. And, in terms of what you're talking about, visiting an animal sanctuary, we've been going weekly to the local, or not so local, it's a 50-minute drive, to go down to the one of the farm sanctuaries around here, and we feed the animals and we put them to sleep, and they have names and they have personalities, and we know which ones to stay away from and when they're in bad moods and all of that. So when you do learn so much more about animals and make that connection to the food that's on your plate, even if the science swayed us in another way that, eating animals would be beneficial for us, I don't even know if I could ever do that again. So you've made some really good points in there.
Right. I find how it's interesting, too, that people come to it from so many different angles now. Like people, watch Game Changers and come to it from the health aspect, or people watch a documentary about the environment and come to it from the environmental aspect. But I think that the more entrenched they get into it, the more that they actually find out about the animals and just really connect with all those levels. And there's so many reasons to do it. I think it's a pretty easy choice. And these days with so many plant-based alternatives, and, when I first became a vegan, there was truly I remember when Daiya cheese came out and I was excited about it. Now there's just so many incredible options for people. It's really easy to be a vegan with so many amazing benefits, and truly one of the best decisions I ever made. I love it.
Well, we're glad you did, and we're glad that you're here today. And you've been doing a lot of work on the front lines over the last, how many months is it? It's about 11 months now.
It's going to be a year.
It's going to be a year. So what have you seen in that year, and has it changed from, March, April, May to now?
Yeah, so I'm from New York City, and I was working at the height of the pandemic in March and April when it hit in New York City. It's still, I was talking with a friend about how I'm still processing a lot of the trauma and grief from it. Where I walk my dog every day is right next to a hospital that had a refrigerated truck outside with bodies in it. The fear and just seeing so many people die in my city it's hard to describe, and it's really heartbreaking. And I think that maybe for a while, the rest of the country thought, that happened to you because you live in New York City and it's busy and it's populated, and, that won't happen here. But then, we saw a rise across the Sun Belt, the South in the summer, that being the second wave, and now we're in the third and the fourth, and there's just no, there's no place really now that's not hard hit and affected. And, at the time of this recording, we have about 400,000 people dead. And having seen it frontline and seeing it happen to the rest of the country, it's really, it's hard to describe how devastating it is. And I think that being on the front lines of it, and one of my roles during the height of the pandemic in New York City was to research, how this virus is transmitted and what we can do to avoid it. My main goal is just to let people know that science and know that there are certain fundamental measures that all of us can take that can make us a lot safer. And in the setting of feeling a lot of hopelessness over so much death, the one place that I've really felt a glimmer of hope is watching the scientific community across the world come together to produce a vaccine as rapidly as we've ever seen one before. And it's for me, it's the light at the end of the tunnel, and and a sense of a feeling that knowing that we can see the suffering come to an end, and that's thanks to science.
And thank you for giving us that background and giving the listeners that background to know that it's basically your job to be doing that science. We've never spoken about vaccines before on the podcast. It's not something that we've brought up ourselves or that we've encouraged any of our guests to bring up. People's opinions or people's beliefs in vaccine, I'd say, is stronger than religion, is stronger than politics sometimes. And we just want to reiterate to the audience that we're giving you the opportunity to place the science in front of us. We're asking the questions that people are coming to us and asking, or people are bringing to our attention. And although it's everybody's decision on what they do next, I think it's everybody needs to listen and to research properly and to have the facts be put in front of them before they make any decisions. So today's episode is very different for us, but also very, very interesting. And just before we get into the vaccines, I wanted to know, in terms of these new strains that have been coming over, is that going to be a second round of threat? And is it going to look the same? And is it going to be a different vaccination?
So right now, all of the different COVID variants that we are aware of all look to be covered by the vaccine. So that's really, really good news, and it's more reason to get people vaccinated as quickly. The concern is that as the virus continues to mutate forward, and we now have 25 million recorded infections in the United States since the pandemic began, that many viral hosts just allows for more and more opportunities for the virus to continue to mutate. The fear being that at some point it could outrun the vaccine, and that we'll need to look into getting some kind of a booster shot sooner rather than we would expect. And as you can see, distribution has been a real challenge in the country, and that provides another threat. So the most prevalent variant that's across the country that is currently hard hitting the UK right now, and probably California as well, is one that is not known to be necessarily more deadly, but much more transmissible. So viruses will always take an opportunity to mutate, to get into more hosts. That's what they do, and that's what they're good at. And this one, whereas you may have needed a longer exposure of time indoors with someone, now this one is much more transmissible. So what might have needed 15 minutes to transfer might only take 5 minutes indoors with someone else. So it's really, really scary, and much, much more reason for everyone to continue with those social distancing measures, avoid indoor gatherings, wear masks as much as possible, try and avoid interactions with others as much as possible, so that you can get vaccinated. And if we can get more people vaccinated before these mutations continue to mutate more and more, then it's just more vaccinated people means less places for that virus to go, less places for that virus to transmit. So again, initial social distancing measures followed by vaccination really is the key.
Earlier, I heard you say the height of the pandemic. And did you mean by that we're past the height and things are looking a little more promising moving forward now?
Absolutely not, and I shouldn't add the initial height of the pandemic is what I should have said. And everyone hoped that it would be, but across the country, the levels are as high, the percentage positive numbers are as high as they were in New York City when it initially struck in the US in March and April. So I should have said the initial height. The levels now are as high as ever. Over the last week, at the time of this recording, we've seen a slight downtick. So most of the high numbers that we see now are what we consider holiday surges. So unfortunately, despite a lot of public health warnings, people did go to travel and visit family over Thanksgiving and Christmas. And so right now, the enormous number of deaths we're seeing is from Christmas and New Year's celebrations and travel over that time. It's starting to decrease, but the big fear among public health experts is that while we are seeing a decrease, we are seeing a rise in this variant that has increased transmissibility, which will put more people back in the hospital and lead to more deaths.
Yeah, thank you for clarifying that. And one of the other things is that this vaccine seems to have come out super quickly to most people. Isn't it true, or is it not true, that vaccines tend to take a long time to prepare to be able to be given out to people, but this one seemed to have been quite quick?
Yeah, absolutely. And so, I, as a physician, when I heard that this vaccine was being developed so quickly and was about to reach its trials, I was interested as well. And I was like, has this been tested enough? Like, what's been the protocol behind this? Because I'm a physician who has participated in a lot of clinical research, and I know that these processes take years and take time. And so, the more I learned about it and the more I looked at the organizations participating in it and these major medical organizations who reviewed it, including the FDA. So there's a lot of steps in research and development that take a long time. So just basic enrolling of trials, of patients in trials, is like a very sort of painfully difficult situation where it's like you have to send in paperwork and get patients to sign papers. All of these things just have this dramatic lifting of a lot of the paperwork requirements and this enormous dedication of everyone in every field of medicine coming together at once to make sure that these pieces were made as easy as possible and happened as quickly as possible. There's also a piece in the vaccine process which takes a long time to culture vaccines. So very often, the way that these vaccines are made is that it has some sort of viral vector that's cultured over time in some sort of culture vector, and this can take months, a lot of time. And so this brand new mRNA vaccine doesn't require that culturing time at all. All it requires is basically a lipid, which is like a plant sterol, some sugar, some salt, and the mRNA vector. So you don't need the months on end. And then finally, the next step after that, let's say you've cultured the vaccine. Now you have to create all the pieces that go with it, right? All of the glass bottles that it gets transported in. These tend to go in a stepwise process. And due to the effort behind this, Operation Warp Speed and all these groups that came together, these were all developed in tandem. And so it was a huge waste of money in a lot of aspects, right? We developed everything to get this vaccine going, and now it's all ready to go, but we determined this vaccine doesn't work and we have to get rid of all of it. That would never happen traditionally, right? Everyone would consider a waste of money, but given the enormous public health implications, these things were all done in tandem, taking months to years off of the process. The one thing that was not shortened or changed in any way was the safety monitoring. The phase 1, 2, and 3 trials cut no corners, took no extra steps. And for the vaccines that are available right now, the Moderna and Pfizer vaccines, most clinical trials have a few thousand patients that we consider really good data. These had 70,000 patients, which is an enormous number. It was studied very well. And we now have about 4.5 million at the time of this recording people vaccinated. It might be closer to 5 million now. And we're seeing no major adverse events. I'm happy to talk about the sort of individual reports that we see, people coming up in detail, but we're not seeing any major health implications. So furthermore, there has never been a more scrutinized public health intervention in our lifetime. And I'll give an example that I got my first vaccine already, the Moderna vaccine, and every day the CDC has messaged me via this app to say how are you feeling today? Any headaches, any something? That's something that doesn't happen anywhere. So they're really, really scrutinizing it to make sure that it continues to be safe for everyone. So while it happened quickly, the steps that compromise were not the steps that are in safety. And so I feel incredibly comfortable with the safety data that's available.
So what I'm hearing is that no steps were skipped, and the amount of hours that would have been put in over months or years, it's the same amount of hours. It was just all done in tandem, and therefore it was able to get out to the public quickly. And it wasn't really starting from scratch either. There was a history about this kind of vaccine already.
Yeah, absolutely. So a lot of people are like, this is a brand new technology. We don't know anything about mRNA vaccines, but it's not true. They've been in development since the 90s. There are Ebola vaccines that have been under research, vaccines for other types of viruses that have been studied for a long time. And we have even more data on mRNA vaccines in general outside of the COVID one that also suggests a strong safety profile.
Thank you for clarifying that. And so before we get into, possible side effects of the vaccination, I want to talk a little bit about post-COVID syndrome or long haul or all of these different names that are out there right now. For people who have had COVID, the COVID is gone, but their symptoms or specific symptoms within the body remain. Can you talk to us a little bit about that?
Yeah, so beyond, a death rate, which far exceeds anything like the flu, that death rate tends to be about 1.5% of people who get COVID in the general population, up to 11% in people who are over 65, or with other comorbid health conditions, a higher percentage as well. For those who survive, about 10% are left with what we call long haul COVID symptoms, which is still being studied by physicians in various specialties, but they include things like permanent heart damage, something called myocarditis, is something that's been seen commonly, and you may have read about it in the news. There are a couple of professional athletes who are basically, in the prime of their life and their career who have been sidelined due to myocarditis and heart inflammation. Lung damage, permanent lung damage that makes scarring from the viral infection, which makes breathing difficult, long-term neurologic effects, which are still being studied. So death is not the only marker that we look at. And so we do know about this. This is well understood, well studied. And so what I'd like to talk about when considering the vaccine, while we really don't see any negative health outcomes, even if you did see some amount of negative health impacts, right, you would have to weigh it against the known serious and severe health impacts that a COVID infection causes. So we're not seeing any health effects from the vaccine so far, but I think that often people think that the high risk activity is this action of getting the vaccine, right? That's the risky activity, but what's truly high risk is inaction, not getting the vaccine, because exposing yourself to COVID is opening up you to much more significant health effects and the risk of death from getting a COVID infection.
And I think that's really important. And in the last week, I'd say I have probably had 2 or 3 people come to me with those long haul symptoms and say, what can I do? How can I change my diet? How can you coach me? How can you get this gone? And that's like a whole new, not strain, but a whole new group of people all of a sudden that need help that didn't necessarily need them before. And the other thing is, what we saw at the beginning of COVID was, it's only affecting the elderly, or it's only affecting people whose immune systems are compromised, or, and you keep hearing things like that. But the truth is that it's also really scary. Like, on the flip side, it's because that could be your mother, that could be your sister, that could be your daughter, or father, brother, son. You know what I'm getting at? But so to think about it in generalization, when people didn't know a lot of people who had it, it was easy to say those words, but now people are so cautious about getting COVID, but also getting the vaccination, because, you hear of this 1 in a million story and you get really scared that 1 in a million could be my kid. Right.
Right. Mm-hmm.
Yeah. So, I understand that people probably have emotion listening to this already, because we're scared and we don't know. And there is a lack of trust sometimes between, the pharmaceutical companies or the medical system and people.
Yeah. And so I think that, especially we as vegans have learned to be skeptical of what industry tells us. I think that we all grew up with a picture of the happy cow on our milk jars. And then we realized that was a lot of corporate, nonsense. We worry, and we've heard stories about pharmaceutical companies doing really shady and terrible things, which I'm not discounting. We also have a ton of reason for people to be skeptical of the medical establishment. I've particularly in people of color with really, really, terrible stories of medical mistreatment, medical racism. And so there is absolutely ample reason to be nervous about pharmaceutical companies, about how the medical industry treats people individually. That all exists. And so, everyone who has a question about vaccines, I'm here to answer it. Like, I understand where that skepticism comes from. But what I do trust in is like the medical establishment and these governing bodies that issue recommendations based on the science. And, that's what I go to as a doctor to treat patients. And I know that these are free from influence. And I know that we're able to look at the data. And sometimes people will say, like, I did my own research. I found something online that said the vaccines aren't safe. But the truth is, none of us can do our own research, right? There's this hierarchy of evidence. You may see one study that says something. And I often tell people, I'm a physician. You shouldn't trust me just because I go on my Instagram page and I'm like, hey, I think you should take this pill. This will be good for you. What you would want to know is, can I back that information up with like large randomized controlled studies that have been evaluated by multiple medical organizations and backed up with consistent science. And so I know that I'm not able to do my own research, but what I am able to do, and hopefully what I'm able to share as a physician, is having the training to know which major medical organizations to look at for trusted scientific health information. And I do my best to share that with you so that we're not all left having to scramble through the science.
You mentioned vegans and vaccines, and I think it's important for us to share the information about what's actually going into the vaccine if we can, and how is it being tested on animals and all those kind of things, so that vegans can be a little more clear on this specific vaccine and if it's something that is okay for them to be taking.
Can I put a pin in there for a minute and
Sure.
just kind of insert? So you've mentioned that you haven't seen side effects of the vaccination. I just wanted to go back, and you mentioned that in your speaking. I just wanted to go back and put that as a question and say, is there anything that we have that they have seen, or are they putting things under the covers? What's happening there?
Right. So like, as I mentioned before, it's the most scrutinized public health intervention ever, right? So anytime we see any sort of health issue or death that comes after a vaccine, it's going to be reported very widely, and it has been. The New York Times put a couple of headlines that there was an allergic reaction to the vaccine. So first, we have seen some allergic reactions. Those are expected with any vaccine. They can happen. And in every case we've seen of allergic reactions, the patients have been given medications to help the allergic reactions, and they have recovered and gone fine. This is a much less significant health thing to happen compared to a COVID infection, right? I would take an allergic reaction over a COVID infection any day, no question. What we will often see is, like you had mentioned earlier, seeing something like Bell's palsy, right? And often I've seen graphics where these are shared with Bell's palsy is something, a neurologic weakness that can happen somewhere in the body, often in the face. And I've started to see these sort of frightening pictures being shared. This many people develop Bell's palsy. If you look at that data, the things that I've seen shared around, like Bell's palsy is an example. We don't always know what causes Bell's palsy, but often it happens in the population at about like 6 people per 100,000, I think is the number. It happens in the population. We've seen less numbers than that when we look at the population of people who have been vaccinated. So correlation is not causation, right? If we're seeing less people get Bell's palsy who have been vaccinated than in the general population altogether, it doesn't suggest a link to the vaccine. Now, absolutely every sort of health outcome that we see that's anything different than perfectly healthy after the vaccine is being rigorously studied, paid attention to, not discounted. But so far, we haven't seen anything that appears to be any link to the vaccine, besides a few allergic reactions, which I've mentioned are well controlled.
So something like Bell's palsy, it almost sounds like it's the straw that broke the camel's back. It's something that would have been inevitable. So maybe with stress of the next, bank statement coming out or something like that, it would have happened anyway, and this maybe just sped it up. Is that a hypothesis?
Sped it up, or it just would have happened anyway, right? There's no way to know. One thing that also got reported, widely was like there were deaths in Norway in a nursing home after the nursing home received the vaccine. But that number of people is generally expected to die, at that age range. When you looked at previous months of that same nursing home, how many people died in that nursing home? It was the same before the vaccine, right? It was the same before COVID. These are not numbers that are happening more. So each time you see an adverse, some report of an adverse health outcome, you have to look at how prevalent is it in the general population? Would it have happened anyway? And I'm paying close attention to it, like everyone in science is. There was one doctor who died in Florida, after receiving from the vaccine from something called ITP, which is like a bleeding disorder. But again, we see that bleeding disorder all the time in the general population, and it's linked to things like, cancers or other medications. So it's being investigated. So far, no link has been found, but I really, really caution everyone to not look at or share, there's been this one report. This is indicative that the vaccine isn't safe. And keep in mind that what's really, truly not safe is a COVID infection, and that's what we're looking to prevent.
We've gotten emails with a lot of what you just mentioned, but there was one question that I want to share, and maybe you could answer it. And the email we got said, the vaccine is very dangerous. Why take a vaccine when COVID survival rate is above 99%? The media focuses on cases rather than deaths. Why is that? Also, there are more deaths overall relating to other fatalities, diseases like cancer, heart problems, etc., than there is COVID. This is not a vaccine. This is an mRNA shot. It changes your DNA for the worse, not the better. What would you say to that?
There's a lot there. So, the first one about the 99% survival rate, as I mentioned, isn't true. In some healthy populations that may be true. But for me to say, I am young and healthy and I have a 99% chance of survival, first of all, that ignores the 10% of people who are left with those long haul symptoms, like we mentioned. And second of all, I think we're vegans because we have compassion. And the reason that I stay home and that I wear masks is not just for myself, it's compassion for others. It's knowing that if I were to have gone to visit my elderly family members at Christmas, that I could have infected them, that I might have survived but that I could have made all of them sick, and that they could have gone into the hospital and made those doctors and nurses sick there, and strained an already overstrained health system. So to say that I might survive, I think is incredibly short-sighted, and I really ask everybody to tap into their sense of compassion into protecting others. The other pieces that were mentioned, I'm trying to remember them all. Change your DNA. So the vaccine itself is an mRNA vector. So it's basically a piece of code. And you would ask about what's in the vaccine earlier. So, there are some vaccines like the flu vaccine, which may have egg bases and things like that. This one absolutely does not. The ingredients are it's held within a lipid vector. Lipid is something it's like cholesterol. It's in your body, and it's a plant-based source for this vaccine. So there's no animal products within the vaccine. The other pieces in it are essentially just salts and sugars. These you can look up on the FDA website. There's nothing hidden. There's no information. There's no information that you can't find about exactly what's in these vaccines. So they are vegan. And I'm trying to remember what else was in
what else was there? Focus on cases rather than deaths. The media.
So again, deaths are not the only marker, and cases are really important because right now hospitals across the country are overwhelmed. And I cannot tell you how exhausted that healthcare practitioners are around the country. And again, even if you're acting purely on a selfish level, if you right now were to get appendicitis and need to go into the hospital, you would probably get substandard care because the hospitals are so completely overrun right now. And for the patients who do survive, many of them need longer hospitalizations. In many states across the country, elective cases, surgical cases and things are being canceled because the healthcare system is at a breaking point. So I think that caseload in that regard is incredibly important.
So that makes me think. So let's say you do have appendicitis and you need to go for surgery, and I don't know a lot about it, but I'm going to make it up here. So work with me. You go in and they're probably going to put you on some kind of antibiotic to make sure that you don't get an infection. They're probably going to give you some kind of painkillers. They're probably going to give you some kind of medicine to help you go to sleep so that you're asleep through the procedure. And in a life and death situation there, or almost life and death situation for maybe other surgeries, you're accepting those medications because it's a serious issue. And then like I said, I have this stream of people starting to come to me and say, how can you help me? I have this one woman who can eat only 3 foods right now. Everything else makes her completely sick. I have another woman who's being verbally abused by her son because he's just in a bad mood all the time and has changed completely because of these long haul symptoms. So when you think about it that way, and you would be willing to put these medications in your body in an emergency case, which is how Adam and I kind of, that's how we live. You need a medication emergency, great. But if you can do all these lifestyle things to avoid ever having to get to need it, that's what we're there for. So this is like that emergency stage. You don't want to be in that situation. You don't want to be the mean person, or, have your kids or spouse be mean to you, abusive to you. You don't want to become allergic to every food. You don't want to have migraines for the rest of your life. Is that kind of the way that we need to be thinking about this?
Yeah, absolutely. And that also brings up something for me as well that you mentioned about animal testing, like saying that the vaccine was tested on animals. So I'm a physician who's been very vocal about how animal testing is often overused and useless, and a lot, doesn't actually give us a lot of data. There are a lot of physicians who discuss, where major changes could be made on that front. But everything that comes to market is tested on animals. This vaccine was tested on animals, but essentially the testing is done, and you getting the vaccine will not cause further animal testing. However, the more that this virus continues to rage on, the more mutations that happen, the more treatments that are going to need to be developed, right? Another vaccine is going to need to be made. More animal testing is going to happen. We're going to have to develop more treatment modalities and investigate that. More animal testing is going to happen on that front. So stopping this virus as quickly as possible is the absolute best way to minimize animal testing. And in terms of doing the least amount of harm to animals, that's what I would recommend, is getting the vaccine.
And it doesn't matter if one person's getting the vaccine or 7 billion people are getting the vaccine. It's going to be the same amount of animals that will be tested on regardless.
Right. It was done. It's done. No further animal testing is happening. That happened in the phase 1 trial a while ago.
Is there any reason for someone not to get the vaccine, or is there someone that like this vaccine is not for this kind of person or someone with this kind of situation?
Sure. So, people who have had a history of serious allergic reactions, those who've had true anaphylaxis in the past, which means an inability to breathe due to an allergic reaction to something, probably already have immunologists that they've established with. And the recommendation is to get the vaccine under the care of their doctor. Anaphylaxis and serious allergic reactions are something that are able to be easily controlled within a healthcare setting, easily treated. So it's recommended to do it in a healthcare setting if you have that medical history. All the other medical conditions that are really common in our populations, things like hypertension, diabetes, cancers, these sorts of things. We know that patients who get COVID have significantly worse health outcomes, so they're really strongly indicated and known to be safe in these populations. There are also groups in which studies haven't happened yet. So pregnant women and breastfeeding women, they didn't carry those out in the initial trials. Those are being studied now. ACOG, which is the American College of Obstetricians and Gynecologists, that's the overseeing body of the guidelines that we look for treating pregnant women, has stated that they don't believe that the vaccine should be withheld from pregnant women. The trials are ongoing, but it appears to be safe. There were a number of women who were pregnant while initially in the trial, and we saw no adverse outcomes in those patients. And so ACOG's recommendation is for pregnant and breastfeeding women to make the decision in tandem with their OBGYN. And then the final group is kids. And so kids haven't been tested yet. Kids have different immune systems, and so we don't know if the vaccine will work as well. Right now, Pfizer has enrolled enough kids up to from 12 years old on. We really do need kids vaccinated in order to reach herd immunity. And so although we know things about kids, like kids younger than 10 don't transmit the virus in the same way that adolescents or adults do, but we do need them vaccinated, so that's not an unvaccinated group, but we just don't have the data right now. So kids aren't being vaccinated at this time. We'll continue to follow that data, and there will be a lot more information on it, hopefully in the next few months.
Perfect. Thank you. And some follow-up questions there. So let's take me, for example, where I've been told to walk around with 2 EpiPens. I have other allergies, but I'm anaphylaxis to shrimp or seafood, or shellfish, I should say, to shellfish. I think I had one anaphylaxis reaction when I was young, which wasn't huge. It was just that I couldn't keep the food down. I've had some small ones along the way, and just in terms of like really needing to get fresh air, take deep breaths, but I've never gone into full anaphylaxis. So is that something, should I not get the vaccine? Do I Is there a question? Do you have an anaphylaxis allergy, or do I just make sure that I'm taking it in a facility that would be able to take care of me if I should go into anaphylaxis in that situation? And would I go into anaphylaxis if it's a shellfish allergy, but there's no shellfish in that?
Right. I think it's really, really unlikely. That you would have that reaction to the vaccine. But like I said, anybody with a history of anaphylactic reaction, it's a good idea just to touch base with your doctor, and so you can figure out what setting is best for you.
There are a lot of people who avoid taking the regular flu shot annually. This is very different, but those people that don't take the flu shot might think, oh, I don't take the flu shot, I don't need this kind of shot either because I'm okay. What would you say to them?
Well, I think we have a couple of examples of vaccines in our population. Like one example is the MMR vaccine that we all get as like a childhood vaccine. And so all of us have, universal coverage that those vaccines last a lifetime. In some people that immunity wanes, but we don't really see these big measles, mumps, rubella outbreaks because we have herd immunity for the most part. While we do see some outbreaks in like under-vaccinated communities, generally you can walk around day to day not worried about catching measles, mumps, or rubella, right? You don't think about it a lot. Now that's because we've for the most part reached herd immunity in our society. The flu vaccine is another example where the opposite is true. We have not reached herd immunity. And so, we only about 50% of people get the flu shot every year. And what that ultimately means is like last year that we reported data, there was like 34,000 deaths. And so in the same way I look at that vaccine, I've always gotten the flu vaccine, not because I'm worried that I'm going to die for the flu. I'm young and healthy, but I do it to protect children and the elderly who really do die in high numbers from the vaccine. As I mentioned before, COVID is not the flu. From the time it started and it's been almost 10 months, we've seen 400,000 US deaths. And so, saying again, back to that thing, I think I'll be fine without it. It's not the only question. Like people who get the flu typically and recover, might have feeling well for a few days, but they're not left with heart damage. They're not left with lung damage. They're not, typically you're not seeing the high numbers of deaths and hospitals being overrun in the same way. So COVID is not the flu, no matter how many memes you see shared about it.
Yeah, it's not the same. And it's hard. I have a 98-year-old grandmother who's kind of trying to avoid the vaccine because she's very proud that she's never had a flu shot and that she's 98 and she's young and healthy and vibrant. And it's hard to change that mindset with her. That reminds me, I got to give her a call.
And, in terms of like my support and how safe I feel about the vaccine, not only have I gotten it myself, but I also have a grandmother who's 96 and she's not in a nursing home because she's very healthy and able-bodied, but she lives in a group facility and they're offering it soon to her. And she asked me if she should get it. And I said, absolutely. So my grandma, who's very near and dear to me, that's how much I trust the vaccine. I've told her to get it. I've gotten it myself.
Thank you. And I think a lot of people need to hear that message and maybe record that clip or send people. I mean, everybody should be sending at least one person this episode because the facts are just so clear and crisp and you're great at explaining everything. Let's be fair because we want to make sure that, all sides are covered. Is there anything else negative to report? Is there anything else that people really need to know?
Yeah, one thing I do let people know is that this vaccine is extremely what we call like immunogenic. It causes a strong immune response based on its vector. And what that means is sometimes that it makes you feel bad. And so I think that needs to be really, really addressed so that people aren't surprised. And so most people get mild soreness, arm soreness, or feel a little fatigued with their first shot. But in a decent percentage of people for the second shot, once you've been primed and your immune system really reacts, people do report feeling fevers, chills, and strong fatigue for a day or so. That's not everybody. It's not going to happen to everybody, but I feel like it's really important to have that informed consent so that people know that they might feel bad. Now, there's nothing live in the vaccine. It can't give you COVID. It's just a code that makes your immune system recognize it. So if you get it and you're feeling sick, you didn't get COVID, you didn't get a little bit of it, but you might feel not so great. It doesn't happen to everybody, but it can happen. So, I like to let people know if they don't feel great, that it's okay.
Dr. Stacy, I think this has been really informative and very important for our listeners and for ourselves to really get the facts and understand the science behind the vaccines and the information and trying to get this herd immunity and everybody in a healthier position. So thank you so much for sharing all of that. If people, there will be tons more questions, I'm sure, coming our way after people listen to this. But if people want to reach out directly to you or have questions for you, where would you like them to go?
Yeah, I have an Instagram that's Stacy De-Lin, STACYDELIN_MD. I have a lot of story highlights where I've covered a lot of these common questions. I have some Instagram TVs up there. I do Q&As from time to time. You know, I think that there's a percentage of people who are hardcore anti-vaccination that no matter what you tell them, they're not going to be swayed. And that, you know, some studies have said that's about 20% of the population. And there's 40% of people who are like, yeah, I want the vaccine no matter what. And there's 40% who have genuine skepticism. And I think that that's really healthy to just have, you know, just want their questions answered. And so that's what I try to do through my Instagram. And I'm really grateful for you guys for bringing this to your audience as well, because I think that, you know, it's a scary time for a lot of reasons. To have these questions is normal. And I'm really grateful to be able to have the conversation about it.
Thank you. We're grateful for you being here.
Awesome. Thank you, guys.